Let's go up to Canada and talk to Steve. Hey, Steve, thanks for the call. You are live.
Yes, how are you, Dr. Glidden?
Oh, fine, thanks. God willing, and the creek don't rise, I'll get better. Thanks for the call.
Thank you very much for taking my call. I was calling because I have a friend. We've been listening to your DVDs and reading up on you and everything, and he decided to go with the Healthy Brain and Heart Pack because he's had some heart bypass done to his heart.
Oh, yeah.
And he was concerned that once he starts healthier and all that, if his arteries start unblocking, that if the extra arteries would be a problem somehow for his heart, for his pressure. And I don't even know if it's a valid question. I guess I don't really understand how, when they do a bypass, is the old artery still there? Is it still, I guess, on the heart? Or
well, these are great questions, and I will answer it for you because it's a really easy thing to visualize and to understand. But again, it speaks volumes to the fact that his medical doctors didn't tell him about the procedure. I mean, they didn't bring him up to speed with it. They didn't tell him what the hell they were going to do. They didn't walk him through it. They might have given him a cursory kind of understanding, but he doesn't know what they did, right? And this is unacceptable as far as I'm concerned. And it's tantamount, right, to you want to buy a car, right? So you go to, a giant car sales lot, giant. They've got 10,000 automobiles there, and you buy the first one that the car salesman shows you without question. You just get in it, give him a check, and drive away. Nobody in their right mind would do that. Nobody. But that's always what we do when we go to the MDs. We don't ask the right questions. The MD is not going to tell us of their own volition what the heck they're going to do to us, because most people wouldn't do it if the MD told us what they're going to do. And this is a big problem. And, again, it speaks to the inherent corruption in a system which has become, a monopoly, right? I mean, it's like the Roman Empire destined to fail, Central American dictatorships, Southeast Asian dictatorships destined to fail because absolute power corrupts absolutely. And this is just the way that it is. And this is what's happening with medicine as it's delivered all around the world now, especially here in North America and the European Union. The MDs just don't tell people what they're going to do. People are completely uneducated about it, and they just give themselves over to the MD because they incorrectly believe that their medical doctor has the secret decoder ring to all things medical, and that the medical doctor knows what's best for them. And sometimes they do, but most of the times they don't. And it's just a crying shame, man. But again, right? I mean, when everybody in the world does this, it becomes the new norm, right? Nobody asks their MD. Oh, they just go to the MD, and, the nicer the waiting room in the hospital, the nicer the artwork that's on the wall, the nicer tie that the medical doctor has, or the pair of shoes that they wear. That's the thing that wins them over to the MD rather than an enumeration or an elucidation of the therapeutics. And it's a crazy social mindset that has evolved here, and it drives me up a freaking wall every time I see people go in for these ridiculous therapeutics without question. It just blows my mind how people would do that. So, to answer the question, there are two different therapeutics that the MDs use when someone is suffering from a blocked artery, especially if it's in the heart or going to the heart or around the heart, adjacent to the heart. One therapeutic is to insert something called a stent. And a stent is like those Chinese finger traps. You stick one finger in one end of it and one finger in the other end of it, and you pull it and it tightens up. You can't get your fingers out. Well, it's kind of like that, except reverse. So it's a little tube that the surgeon will insert into an artery that's been all gummed up with cholesterol. After the tube is inserted, there's a little mechanism that's activated which makes the tube expand. The intention of the stent is to artificially increase the internal diameter of the blocked artery, right? And effectively squishes the blockage between the wall of the stent and the wall of the artery, right? It artificially dilates from the inside the diameter of the artery. Now, a stent is a mechanical device, and it does absolutely nothing to the physiological process which made the cholesterol or the plaque or the calcium deposit in the first place. It does nothing to the physiological process that made the artery get clogged up in the first place. It's just a mechanical diameter maker. It increases the internal diameter of the artery. Now, stents fail after about 5 years. And again, it's the rare surgeon that's going to tell the cardiac patient that the stent is going to fail in 5 years. I don't know why they don't tell them that, but they all do. Because again, the stent does nothing to get to the root cause of the illness. It's like painting over the mold in the basement, right? It's only a matter of time until the whole wall of the house falls off because the mold has gotten so bad and the rot's gotten so bad. You can't just paint over it. It's going to get worse. Well, the stent is like painting over the mold. So it's a ridiculous therapeutic, in my opinion, number one. Number two, the bypass is where they harvest a blood vessel, usually from your leg. They'll take out a vein or an artery from your leg. It's usually a vein that they take out. And then they'll stick it into the heart. They'll put one end of it into the heart, and the other end they sew into one of the other blood vessels in your heart that's not so clogged. And the intention here is to increase the blood flow to the heart. Now, very interesting thing happened. Years ago, when this procedure was first started, the bypass surgery, they did a very interesting experiment. And since they did this experiment, they passed laws making this experiment illegal, and inquiring minds want to know why. They took a number of patients. They told they were going to have a bypass surgery. They had all the signs and symptoms of, bad hearts. And they knocked them out with general anesthesia. They cut their chest open, and then they sewed them back up, and they did absolutely nothing to the heart. The vast majority of the people that they did that to got better after the surgery, and for years after, they were completely better. All of their signs and symptoms were gone, and they were as good as people who had actually gotten the bypass surgery. And this really is where the term, the placebo effect, really kind of got legs, right? Because in clinical settings, the placebo was kind of this thing in the background that maybe was there sometimes, but a placebo effect could never, ever possibly be present for something as big as open heart surgery, but guess what it was? So there's a lot of stuff going on here when they cut somebody's chest open and just when somebody psychologically prepares for a surgical procedure. But nonetheless, the bypass surgery, the physiological thing that happens there, they harvest a vein from your leg and they punch one end of it into your heart and sew it in there, and they punch the other end into an artery that has good blood in it that's not blocked up so much, and they sew it in there to increase the blood flow to the heart. Neither of these two procedures does anything whatsoever to get to the root cause of why the artery got blocked in the first place. Nothing. They do nothing to fix the problem because, again, remember, the MD believes that it's either unfixable or that it's a genetic thing that's so unbelievably freaking complicated that nobody in their right mind is ever going to be able to figure it out. And, eventually what they're going to want to do is just give everybody a fake heart. Let's wait until the boys at Apple or the boys at Microsoft invent, the next generation of artificial hearts and artificial veins and arteries, and then we'll give everybody those, and that's how they're going to eliminate heart disease, right? And it's a fool's errand. So taking medical nutrition, if you have a stent or a bypass surgery, is going to do zero harm. And if you follow our lead, we believe that we have a rational solution which effectively gets to the root cause of what's causing the arteries to get all jammed up in the first place, right? It's oxidative damage. Oxidative damage to the circulatory system causes inflammation in the walls of the arteries, and inflammation in the walls of the arteries causes the deposition of cholesterol in order to heal the wall of the artery. And this is our fundamental working belief. So the strategy here to support and promote the cardiovascular system would be one healthy brain and heart pack for 100 pounds of body weight per month, 100,000 ORAC of antioxidants a day, and one bottle of Ultimate Daily Capsules for 200 pounds per month. I don't care how you get the ORAC into the body, 100,000 ORAC of antioxidants a day on top of the healthy brain and heart pack. There is no harm and no foul here for doing any of these things in downstream of these medical procedures.